in the south and they spend the summers up north. Often these are retirees or people who can afford to live in different places. But we have a lot of people in the IT business now that can work off their computer. They could be anywhere. So we see a fair number of people who do this. In 2011, I took a routine bite wing radiograph, and if we look, we can see that there's some crowns, but there's no endo. If we look when she came back 6 months later, there's an endo on the sixth tooth. So obviously, she was in her winter home. She had a toothache. She went to the dentist. The dentist said you needed a root canal. She went to the endodontist. She had the root canal done. She comes back and she says to me, "It still hurts." And I'm thinking, you know, is it that tooth? I mean, the endo looks fine. I'm not seeing any evidence of failure in this endo. So I have to think, what's happening? The tooth has a crown on it, so it's not a cracked tooth. You know, there's no caries present. The tooth was healthy 6 months previously. So what we do is we do the normal things that you would do every day. We have to rule out any sort of organic disease. We perform a clinical exam, we probe all the pockets, we take a radiograph, we look for caries, periodontal disease, endodontic problems, cracked teeth. We like to ask the patient, you know, does it hurt now? And they say, no, it doesn't hurt now. When does it hurt? It hurts when I do this. And they move their mandible to one side. Or we say, can you make it hurt? And they say, sure, if I move my jaw to one side. So we take a recording with a T-scan where we have them go from the maximum intercuspation position over to where it hurts, and back to maximum intercuspation, and over to where it hurts. And we look to see, are there any occlusal factors that pop up in the middle that make us look at that and say, you know, there's a problem here. And so here's her T-scan, and this is a little different kind of movie because we've been talking about the movies of closure. We haven't really looked at excursions, or we looked at excursions before. This is a movie where I had her bite down, move to the left, go back to the middle, back to the left, go back to the middle, go back to the left. And so what we can see is that there's the black line goes from 0, it goes up to close to 100%, it then comes down, and it goes up, it goes down, it goes up, and it goes down. The left side is green, so the green starts in the middle. Then when she's on her left side, the green is at 100%, so she's moving from left to right, left, or left to the middle, left to the middle, left to the middle.